Welcome to Canna-Science Digest number 4, where we break down the top 3 cannabis science articles of the week. Sponsored by CBDSciences, the makers of Plus CBD, whose excellent CBD and THC products. Use the coupon code LEX for 30% off. First, this paper out of Thailand, where they interviewed 900 chronic pain patients, both those with cancer and without cancer. And of those using cannabis, the most common reasons were for pain control, followed by insomnia. The most common form they used was oil extracts, and an assessment in the cancer patients showed cannabis causing an increase of appetite, a lessening of anxiety, and more enjoyment of life. They reported no serious side effects and just the common negatives of dry mouth, drowsiness, and headaches. The researchers were quoted to say, most of the patients believe that cannabis can be used with other drugs without drug interactions and that a small amount should not cause serious side effects. For more of the many studies on cannabinoids for pain, check out the pain page where I collected all the data on CVResearch.info. Next, cannabis and aerobic exercise. In this naturalistic first-of-its-kind study, people who were participating in aerobic exercise were allowed to use cannabis ad libitum, which is the technical term for as much as they wanted. And so they used either THC-rich or CBD-rich flower, and after using cannabis and exercising, the people reported a more positive affect, more enjoyment, and an increased feeling of the runner's high. And by the way, we now think that the runner's high might be linked to the endocannabinoid system, and that's where that high is coming from. The people also reported more exertion when using cannabis, which for some reason the researchers marked as a negative, but I thought more exertion would be a good thing. So overall, this study dovetails with the many surveys of people reporting that the cannabinoids improve their workouts. And as someone who only goes running after I visit the basement, I concur. Finally, a German survey of people before and after they started using medical cannabis-based products. They surveyed 155 people, and for those suffering from pain, they reported a reduction in pain. For those suffering from spasticity, they reported less spasticity and better physical mobility. But even more intriguingly, when asked after the start of their cannabinoid regimen, they reported greater satisfaction with their overall medical therapy, as well as improved well-being and fewer problems on the PROMIS scale, which is Patient-Reported Outcomes Measurement Information System. The researchers pointed out, data suggests clinically relevant effects for most of those scores, and most participants experienced their therapy with cannabinoids as more effective than their previous therapies. That's the Canna-Science Digest for this week. To see my weekly update, join the Substack newsletter Cannabinoids the People, or to see all the data I collected, check out CVResearch.info.